Welcome to Senior Health, your trusted companion in making the golden years truly golden, full of health, vitality, and joy. Today, we're tackling one of the most important health topics you could ever explore, especially as you age. The subject is crucial and could significantly impact your quality of life for many years to come. The 10 warning signs of cancer you should never ignore. Now, cancer, it's a word that understandably might make you uneasy, perhaps even anxious, but let's be clear right from the start. This video isn't about spreading fear. Quite the opposite, actually. Our goal today is empowerment, giving you the knowledge, confidence, and awareness needed to catch potential health problems early, at a stage when they are most treatable. Here's a powerful truth. Cancer is one of the leading health challenges faced by adults over 60. However, and this is vital, if detected early, the majority of cancers are highly treatable and often curable. Unfortunately, many older adults mistakenly dismiss early cancer signs as simply the normal aches, pains, and changes that come with aging. That's why today we're going to carefully walk through 10 key signals your body might be sending you, subtle but serious warnings you should never overlook. Imagine this scenario for a moment. A 72-year-old man notices he's losing weight unexpectedly. He hasn't changed his diet or his daily routine, yet the pounds keep falling off. Because he acted quickly and spoke with his doctor about this seemingly innocent change, he discovered a small tumor in his pancreas, early enough to be treated successfully. Today he's thriving, enjoying life with his family, healthy and happy because he paid attention to that quiet yet powerful signal from his body. Stories like these highlight precisely why we're having this conversation today. Perhaps right now you're here, watching this video, not by accident, but because you're exactly where you need to be. Maybe the information you learned today could someday help you or someone you deeply care about navigate a critical health challenge, changing a potential crisis into a manageable situation. So please, take a moment to really tune in. Your health, your future, and the quality of life you experience in these precious years ahead could depend greatly on your awareness. Knowing what to watch for could save your life or the life of someone you love. Together, let's uncover clearly, step by step, these crucial warning signs that cancer may be quietly developing. By understanding these signals early, you empower yourself with the opportunity to act decisively, confidently, and positively. Remember, your health is the greatest asset you have, the foundation of all the joy, peace, and wonderful memories you continue to build every day. Before we dive into the specific signs, let's take a brief moment to clearly understand what cancer really is and why it becomes increasingly relevant as we age. Simply put, cancer occurs when some of the body's cells begin to grow uncontrollably. Normally, our cells follow a very orderly process. They grow, divide, and then die, making room for new, healthy cells. This is a natural, carefully balanced cycle that keeps us healthy and our bodies functioning smoothly. But sometimes, something goes wrong. Cells become damaged, and instead of dying off as they should, they continue multiplying rapidly. These abnormal cells form growths or lumps called tumors. And while some tumors are benign, meaning they don't spread and often aren't harmful, malignant tumors, the ones we call cancers, can spread throughout the body, damaging healthy tissues and organs. Now here's an important point specifically for older adults. As we age, our body's ability to repair and regulate cells naturally weakens. Over time, exposure to factors like environmental toxins, smoking, poor diet, chronic stress, and even genetic predispositions accumulate, increasing our risk of cancer significantly. In fact, according to recent studies, adults over the age of 60 have a substantially higher chance of developing many forms of cancer compared to younger individuals. Common types include colorectal cancer, breast cancer, prostate cancer, lung cancer, skin cancer, and cancers of the reproductive organs. That's exactly why knowing what signs to watch for becomes incredibly critical after the age of 60. Here's the reassuring part, though. Many cancers today can be treated successfully, often completely cured if caught early enough. Medical technology, diagnostic techniques, and treatment methods have advanced dramatically, offering tremendous hope and optimism, especially to older adults who stay proactive about their health. That's precisely why we're here together today. Because the difference between catching cancer early or discovering it too late can be enormous, both in terms of treatment options and outcomes. Understanding cancer isn't just about medical knowledge, it's about empowering yourself with confidence and action. By knowing what cancer is, how it develops, and why early detection matters, you take a crucial step toward a longer, healthier, and more vibrant life. So now that we clearly understand what cancer is and why older adults face higher risks, It's time to move into the heart of today's message. Those vital early warning signs your body might be trying to send you right now. Let's explore them carefully, one by one, so you can protect yourself and your loved ones with clarity, confidence, and timely action. Let's begin with the first and often most overlooked warning sign: unexplained weight loss. Now, many people think losing weight is always a good thing, especially if you've been trying to eat healthier or become more active. But when the weight starts dropping without any change in your habits, that's when it's time to pause and pay attention. If you suddenly lose 10 pounds or more in a short period, without dieting, without exercising more, without meaning to, your body could be telling you something serious. This kind of weight loss might seem harmless, but in reality, it can be one of the earliest signs of several types of cancer. For example, cancers of the pancreas, stomach, esophagus, or lungs often cause your metabolism to speed up or affect your ability to absorb nutrients, resulting in sudden and unexplained weight loss. Why does this happen? As cancer cells grow, they demand more energy, more fuel. They hijack the body's resources, causing your system to burn calories at an abnormal rate. In some cases, the immune system also releases substances that alter your metabolism, and the pounds begin to slip away, even if your appetite stays the same. That's why it's important not to brush it off. If you or someone you love is losing weight quickly without a clear reason, don't just celebrate. Ask questions, keep track, talk to your doctor. It could be nothing, or it could be the earliest clue that something deeper is happening inside your body. Remember, early action saves lives, and weight loss that doesn't make sense deserves your full attention. Now let's move on to the second major warning sign: persistent fatigue. And we're not talking about just feeling tired after a busy day. We're not even talking about the usual sleepiness that comes with aging or a poor night's rest. This is something different, something deeper. Persistent fatigue, the kind we're concerned about, feels like your body is running on empty all the time, even after a full night of sleep, even when you haven't done anything strenuous. It's the kind of exhaustion that doesn't go away, and it can affect your ability to think clearly, move around, or even get through your normal daily routine. So why is this such a concern? Because certain cancers, especially leukemia, colon cancer, and stomach cancer, can cause this kind of extreme, long-lasting fatigue. These types of cancer often disrupt how your body produces energy. Sometimes the cancer cells consume more nutrients than your body can handle, or internal bleeding slowly reduces your red blood cells, leading to anemia. And when your blood carries less oxygen, your whole body starts to feel drained. What makes fatigue so tricky is that it's easy to ignore. You might assume you're just getting older, or that you've been under more stress than usual. And while that could be true, if the fatigue lingers for weeks or keeps getting worse, it's time to look deeper. Ask yourself, does rest help, or does the tiredness stay no matter what you do? If your energy just doesn't come back, don't brush it off. Your body could be waving a red flag, quietly but clearly. When in doubt, check it out. Fatigue is your body's voice. Listen to it before it has to start shouting. The third sign you should never ignore is ongoing pain without explanation. Now, as we age, it's normal to experience more aches and stiffness. Maybe your knees ache when the weather changes, or your back feels sore after gardening. That's part of the natural wear and tear of life. But what we're talking about here is something different: pain that lingers, deepens, or seems to come from nowhere, and just won't go away. Pain that lasts for weeks or months without a clear cause is your body's way of sounding the alarm. Let's say you have a persistent headache that never fully goes away, or lower back pain that doesn't respond to rest or medications, or abdominal discomfort that keeps coming back. These aren't just old age symptoms. They could be early warning signs of something more serious, like bone cancer, brain tumors, liver cancer, or ovarian cancer, depending on where the pain is located. Pain happens because cancer can press on nerves, bones, or organs. In some cases, it causes inflammation or creates pressure inside the body. And here's the tricky part: pain might not appear until the cancer's already grown to a more advanced stage. That's why early, mysterious pain is so important to investigate. Even if it's dull, even if it's mild, if it's consistent, it matters. Here's what you should look for: pain that keeps you up at night, pain that doesn't respond to rest, ice, or over-the-counter meds, pain that feels different than anything you've had before. Don't dismiss it. Don't wait for it to get worse. Your body is telling you something. Listen carefully and speak with your doctor. Because when it comes to cancer, early pain is never something to push aside. The fourth sign is one that many people overlook: skin changes. But your skin can tell you a lot about what's happening inside your body. Of course, As we age, our skin naturally wrinkles, becomes thinner, and may develop age spots. That's normal. But certain changes should raise red flags, especially when they appear suddenly or evolve over time. If you notice a new mole or an existing mole that changes in size, shape, or color, don't ignore it. This could be an early sign of melanoma, one of the most dangerous forms of skin cancer. Melanoma can spread quickly if left untreated, but when caught early, it's highly treatable, even curable. Look out for moles or spots that are asymmetrical, have irregular or blurry borders, show multiple colors, brown, black, red, or white, are larger than a pencil eraser, or start to bleed, itch, or crust over. These changes aren't just cosmetic, they could be your skin's way of signaling something deeper. But it's not just about moles. Other types of skin cancer, like basal cell carcinoma and squamous cell carcinoma, might look like flat, scaly patches, pink bumps, or sores that don't heal. If something on your skin keeps returning, keeps growing, or just doesn't feel right, don't wait. And remember, skin cancer doesn't only happen on your face or arms, it can appear anywhere, including the back, scalp, feet, or even under your nails. Take the time to regularly check your skin, ask a loved one to help inspect hard-to-see places, and if something looks or feels different, make an appointment. Your skin is your largest organ. It's also one of the most visible, and that makes it one of your best allies in spotting cancer early. Now let's talk about the fifth sign, a persistent cough or hoarseness. Almost everyone gets a cough now and then, especially during cold or allergy season, and sometimes your voice gets raspy if you've been talking a lot or cheering at an event. But when a cough doesn't go away or your voice stays hoarse for more than 3 weeks, it's time to take it seriously. The chronic cough can be one of the earliest signs of lung cancer, especially in non-smokers where it's often missed. For smokers or former smokers, this symptom is even more critical. But it's not just the lungs. Cancer of the larynx, thyroid, or throat can also cause hoarseness or changes in your voice. What should you listen for? A cough that lingers and doesn't improve? A dry cough that gradually worsens? Hoarseness that starts suddenly and won't go away? A voice that sounds strained, weak, or unusually rough? Or a feeling like something is stuck in your throat? Sometimes people ignore this because it doesn't hurt, or they assume it's just part of getting older. But when something changes in your voice, something you use every day, that's not a coincidence, it's a message. Especially if it's accompanied by shortness of breath, chest pain, or unexplained weight loss. Don't wait. See your doctor. A simple scan or examination can make all the difference. Your voice is unique. It's how you share your thoughts, your laughter, your love. Don't let something dangerous silence it. Let's move on to the sixth warning sign, difficulty swallowing or ongoing indigestion. Now, it's not uncommon to experience occasional heartburn or indigestion, especially after a large or spicy meal. But when these symptoms become frequent, uncomfortable, or start to interfere with daily life, they might be more than just digestion issues. Trouble swallowing, also called dysphagia, can feel like food is getting stuck in your throat or chest. You might notice that it takes longer to eat or that swallowing causes pain or pressure. Sometimes people begin avoiding certain foods or even lose weight because eating becomes such a struggle. Persistent swallowing problems can be an early sign of esophageal cancer, throat cancer, or even stomach cancer. And because they start off so subtly, many people ignore them, thinking it's just part of aging, stress, or reflux. Indigestion that sticks around is another red flag. We're talking about burning in the upper abdomen, a feeling of fullness even after small meals, nausea or bloating that happens regularly, or discomfort that worsens over time. These symptoms may be connected to gastric cancers, which often grow silently until they've advanced, but catching them early, when symptoms first begin, is when treatments are most effective. If swallowing becomes uncomfortable, if eating no longer feels easy, or if your digestion just isn't the same anymore, don't just pop an antacid and move on. Your digestive tract is trying to communicate. Listen to it. Talk to your doctor. They may recommend an endoscopy or imaging test, simple procedures that could provide life-saving information. Eating should never feel like a burden, and when it does, it's time to find out why. Now let's talk about one of the most alarming signs, unusual bleeding or discharge. Bleeding, when it happens unexpectedly, is never something to ignore. Your body is incredibly good at maintaining balance, and when blood appears where it shouldn't, it's often a strong message that something is wrong. Let's break it down. While it might look bright red or dark and tarry, either one could mean bleeding somewhere in your digestive tract. And while hemorrhoids are a common cause, especially in older adults, it's important not to assume. Get it checked. Blood in your urine, known as hematuria, might be caused by a urinary tract infection, but it can also be a symptom of bladder cancer or kidney cancer, especially if the bleeding keeps returning or comes with back pain or urinary changes. For women, postmenopausal bleeding, any spotting or flow after menopause should always be evaluated as signal endometrial or cervical cancer. This symptom is often overlooked or dismissed as hormonal, but even light bleeding deserves attention. You should also pay attention to unusual discharge from the nipples, the reproductive tract, or anywhere else on the body. Discharge that has a foul odor, is bloody, or comes without explanation can sometimes point to infections, but it can also be related to breast cancer, cervical cancer, or other internal tumors. These signs may feel uncomfortable to talk about, but your health matters more than your embarrassment. Your doctor has heard it all before, and asking the question might save your life. If your body is bleeding without reason, don't wait, don't guess, act. Early detection always gives you the best chance at healing. Sign number 8 may feel a little personal, but it's one of the most important ones to watch for: changes in bathroom habits. Let's face it, most people don't like to talk about their bowel movements or how often they urinate, but the truth is, your bathroom routine is a powerful window into your overall health, and sudden changes may be your body's early warning signal. So what kinds of changes should you watch for? If you notice new or persistent constipation, diarrhea, or a shift in the consistency of your stool that lasts for more than a few days, it may indicate something more serious. Especially if you're also seeing blood, mucus, or a change in the shape of your stool, like pencil-thin stools. These could be signs of colorectal cancer. Colorectal cancer is one of the most common types in adults over 60, and it often begins silently. But changes in how your digestive system works, how often you go, how your stool looks, or whether you feel like you're fully emptying can speak volumes. Now let's talk about urinary changes. If you suddenly begin to urinate more frequently, experience pain or burning, feel like your bladder isn't emptying, or start waking up multiple times at night to use the bathroom, it could be more than just aging. While these symptoms might be caused by common issues like an enlarged prostate or a urinary tract infection, they can also point to bladder cancer, kidney cancer, or prostate cancer, especially if you also notice blood in your urine or back pain. The bottom line, if your bathroom habits have changed and stayed that way, don't wait and hope it goes back to normal. Monitor the changes, take notes. Bring them to your doctor. Your body speaks in patterns, and your daily routines, even the ones we don't talk about, often say the most. Now let's talk about warning sign number 9, lumps or unusual swelling. If you ever discover a lump, a bump, or a swollen area on your body that wasn't there before, don't ignore it, even if it doesn't hurt, even if it seems small. Your body doesn't grow extra tissue without a reason. Many types of cancer begin silently as a small, painless lump. Over time, that lump can grow, spread, and invade nearby tissues. But if you catch it early, you give yourself the best possible chance to stop it before it becomes dangerous. So, what should you look for? A firm lump under your skin, especially in the neck, underarms, groin, or breast. A swelling that doesn't go down. A lump that slowly gets larger. Or a spot that feels different from the surrounding area, harder, more dense, or oddly shaped. For women, a lump in the breast is one of the most common warning signs of breast cancer. It might feel like a pea, a marble, or just a thickening in one area. It might not be painful, and that's why it gets missed. For men, a lump in the testicle, even if it's painless, could signal testicular cancer, and in both men and women, lymphoma and leukemia can cause painless swellings in lymph nodes, especially in the neck or armpits. These are often dismissed as just a cold or swollen glands, but if the swelling stays for more than 2 weeks, it's time to investigate. Sometimes these changes are slow, subtle, easy to overlook, but your hands are powerful tools. Regular self-checks, especially after a shower or before bed, can help you spot these differences early. And if you find something, don't panic, but don't delay either. Let your doctor take a look. One small check could make all the difference. And now we've reached the 10th and final warning sign on our list: persistent fever or frequent infections. A fever is your body's natural defense. It rises when your immune system is fighting off something. But when a fever lingers for weeks or keeps coming back, even though you haven't had a cold or infection, It could be a sign that your body is battling something deeper. This is especially true with certain blood cancers, like leukemia or lymphoma. These types of cancer weaken the immune system from the inside out, affecting the very cells that fight off illness. As a result, you might start catching colds more often, feel like you're always getting sick, or struggle to shake off minor infections that used to be no big deal. In other cases, your temperature might just stay slightly elevated, not a full-blown fever, but warm enough to make you feel off, tired, or foggy. You might not even notice it unless you're checking regularly. Here are some red flags to look for. A low-grade fever that lasts more than 10 days. Frequent infections. Sinus, throat, bladder, or skin. Chills, night sweats, or sweating without reason. Or a general sense of being unwell that just won't go away. These symptoms are often subtle and easy to explain away, but if they become persistent or start interfering with daily life, don't dismiss them. Your immune system is one of your greatest defenders, and if it's struggling, you deserve to know why. Get your labs checked. Ask your doctor for a complete blood count. It's a simple test and it can reveal so much. Because when your body is quietly fighting something serious, catching it early is your best protection. Now that we've walked through the 10 most important warning signs of cancer, let's take a moment to answer some of the most common questions older adults ask about cancer symptoms. Because understanding the signs is one thing, knowing what to do with that information is what really matters. 1. If I have one of these symptoms, does that mean I have cancer? Not necessarily, but here's the key. If a symptom is new, persistent, or getting worse over time, it should never be ignored. It doesn't mean panic, it means investigation. 2. Is cancer always painful? No, not always. That's why it's so important to listen for subtle changes, not just painful ones. 3. I'm over 65. Aren't these changes just part of aging? Aging causes change, but discomfort isn't guaranteed. If it feels wrong, check it. 4. Can cancer be genetic? Should I get checked if a family member had it? Yes, family history matters. Tell your doctor if cancer runs in your family. 5. What kind of doctor should I see if I'm worried? Start with your primary care provider, then get referred if needed. Don't self-diagnose. Ask early. 6. Are there simple tests that can catch cancer early? Yes, and many are covered by insurance. Colonoscopy, mammogram, PSA, CBC, early saves lives. 7. What if I'm afraid to know the answer? That fear is normal, but answers bring action. Knowledge gives you a plan gives you power. Now that you know what to look for, let's shift gears and talk about something even more empowering: how to lower your cancer risk, especially after age 60. Because while cancer can sometimes appear without warning, there's good news. A large number of cancers are linked to lifestyle and environment, not just genetics, and that means there's a lot you can do to protect yourself. Let's walk through a few simple, science-backed ways to support your body and reduce your risk, one step at a time. 1. Stay on top of your screenings. That includes a colonoscopy every 10 years starting at age 45, mammograms every 1-2 years for women, PSA tests for men, yearly skin checks, low-dose CT for smokers. 2. Eat for longevity. Fill half your plate with vegetables. Choose whole grains. Use olive oil. Eat lean proteins. Limit processed meats, sugary drinks, excess carbs, too much alcohol. Food isn't just fuel, it's medicine, or it's poison. Every meal is a choice to heal. 3. Move your body. Even gentle movement, 30 minutes a day, lowers your risk. Boosts mood, memory, and sleep too. 4. Watch your weight, especially around the belly. Maintaining a healthy weight after 60 reduces the risk of 13 cancers. 5. Don't smoke, and avoid secondhand smoke. Smoking raises your risk for many cancers beyond just lung, mouth, throat, pancreas, bladder, and more. 6. Get your vitamin D. Low vitamin D has been linked to higher cancer risk. Sunshine plus food plus supplements if needed. 7. Sleep and stress matter too. Chronic stress and poor sleep weaken your immune system. Try breathing, gratitude, prayer. Let's take a moment and breathe. You've just walked through 10 of the most important signs your body can send, signs that may be quiet but never meaningless. You also learned that cancer doesn't always start with a bang. Sometimes it whispers. It changes how you feel, how you sleep, how you eat, or how you move in ways that are easy to dismiss. until it's too late. But you're here. You've taken the first, most powerful step, awareness. Because knowing what to look for and having the courage to act could be the very thing that protects your health, your independence, your future. Here's what I hope you remember. If your body is losing weight without reason, if fatigue won't go away, if pain lingers longer than it should, if your skin, your voice, your appetite, or your energy feels off, if you're bleeding without cause, if lumps appear or infections return, don't guess, don't wait, get it checked. You are never too old to ask questions. You are never too late to make a change. You are never too much trouble to be heard. Because the sooner you catch a problem, the more options you have, the more choices, the more peace of mind, the more time with the people you love. So please, trust your instincts, track your symptoms, talk to your doctor, and don't stop advocating for your health, no matter your age. Make sure to get your routine screenings, eat nourishing food, move gently every day, rest fully, hydrate well, laugh often, stay curious, and most of all, stay connected. Because health is not just about what you feel in your body, it's about what you believe is possible. And right now, you have more power than you realize. So let's end this video not with fear, but with strength. Not with worry, but with hope. And not with silence, but with action. Share this message, send it to someone you care about, help spread awareness. And if you haven't already, hit subscribe to Senior Health Live so you never miss the information that could change or even save your life. Thank you for watching, thank you for caring, and above all, thank you for showing up for your health. Until next time, take care of yourself, because you're worth it.